Okay, so a few words about coding and recording procedures, principal and provisional diagnosis. Um, just so you know, I will, when we're doing the case study write ups, you'll have, I'll be doing, well, maybe not obviously. I will be doing those with you. So I have my own, what I call instructor versions um, of each case study that we're going to do together. So you can see how I write the code and diagnosis out in what order, what that looks like. Um, a lot of times you're going to be, and maybe you know this already from field work, a lot of times you're going to be you're going to be entering an assessment directly into an electronic medical record or electronic form of some kind that's going to say, put this in this field and this in this field, and it'll sort of organize it for you. And well, frankly, that's going to be the case. But there may be other cases where you are writing a more sort of, a Word document type of assessment and having it, and you may be in the context of advocacy for a client where the format and making sure it's really professional looking and well written and following DSM guidelines can make a difference in your ability to advocate for resources for that client. Um, the most recent time, I guess that came up for me because I've worked mostly in electronic medical record in my own practice here. Um, but occasionally I'm asked to write letters, usually more letters than necessarily sending full assessments out, but for people with legal issues and um, things like short-term disability and stuff like that. Of course, only done with express written consent by the client, of course. But there are times where these are more free text written and not put into a form, and remembering how to write those things well. When I did school social work, the last time I did school social work, which is, I think they don't have electronic medical record in the school systems or most school systems. So if you're writing a social work assessment, social work psychosocial assessment, for instance, making sure you write the diagnostic part in the DSM format and make sure it's really professional looking and reads professionally well can make a difference in getting resources for your client. That was definitely the case when I was working in doing school social work and other instances that come up in my private practice, as I said. Okay, so that's just a word on that. Um, the So you can read about the principal versus provisional diagnosis. Um, I will, you'll see there. I sort of revisited that concept of sometimes how much data you have to reach a principal versus a provisional diagnosis is depending on the setting that you're in and which often dictates how much time you're getting with a client. So um, anyway, so that's that. The only other thing I'll say is that most of the case studies that you're doing will be you'll more likely find yourself arriving at a provisional diagnosis. If you feel like you've got enough criteria for a principal diagnosis, I'm completely good with that. What I'm going to look for in your write up is, did you evidence that? Did you say, I've got to, say, here's the data I got. It meets a sufficient amount of criteria for this diagnosis to render it as like full criteria is met based on the data that I have, even if it was just in a 10-minute segment. And that's completely fine, just as long as you sort of show how you arrived at that. Okay. So, but a lot of times you'll say, no, here's the data that I would still need, of course, which will be part of our exercises. Um, the last thing there, and you see it written down here in this area, duration can be a really important factor. We'll talk about that when it comes to schizophrenia. I have definitely seen many times over people get a diagnosis of schizophrenia because of the particular presentation they have in an acute care setting. And we don't know that client. Sorry, I was using patient and client interchangeably there. We don't know that individual. Sometimes we have records and we can piece together, hey, this person's been in here n number of times the last 6 months. We have a higher level of confidence in that standpoint that we're looking at schizophrenia. But a lot of times, I'll know that individual, And a diagnosis of schizophrenia is given even provisionally based on a singular presentation without being disciplined about, okay, do we have evidence to support that duration? And that can be a critical disservice to a client. Okay, so that's it on a little additional context for coding, principal, and provisional diagnosis.